Strict lockdowns save lives. That's New Zealand's philosophy for dealing with COVID-19. Taiwan avoided them. It preferred tests, quarantines and masks to contain the virus's spread. Initially, both islands enjoyed success. But that changed for Taiwan. What happened? And is one government's approach better? Welcome to the show. I'm Ben Fazul, and today we'll be talking to the co-author of a report assessing the outbreak responses of New Zealand and Taiwan. It was recently hit by the Alpha variant. It hit hard, despite the government's expertise in dealing with outbreaks of other diseases like SARS.
Running in and out every day, 39-year-old Mr. Chen delivers 300 orders a week. The recent COVID outbreak in Taiwan has brought him more orders. But he has to take more risks since nearly 85% of Taiwan's population isn't vaccinated.
I live with my 5 children, my wife, and my mother. You ask me if I'm worried about them? Of course I am. I have so many children, and I worry that I might get them infected.
As a father of 5, he has no choice but to go out and make money.
I hope the government can offer food delivery drivers vaccines as soon as possible. We're in contact with so many people, dozens, if not hundreds, every day.
Many are still waiting. The vaccination program for high-risk groups started rolling in June. So far, just 15% of Taiwan's 23.5 million people have been vaccinated.
There isn't enough vaccine support. Only when we have enough vaccines can we do mass vaccination. That's the first layer protection for all of the people.
Some say success containing the virus and the insistence on developing domestic vaccines might have delayed Taiwan's vaccine acquisition.
It was our misjudgment last year, not being able to foresee that there will be such vaccine shortage. And we might have been a bit too confident about what we could do in terms of our own domestically developed vaccine.
2 Taiwanese drug makers revealed phase 2 clinical trials in June and applied for emergency use authorization, but their effectiveness still needs to be examined.
Whether it's efficacious or not still remains an open question, but at least there's sufficient scientific data to think it might be efficacious in such regard, just to have it approved in case of need so we can use it.
While the Taiwanese vaccines await authorization, the government is trying its best to secure more jobs overseas, so that people like Mr. Chen no longer need to worry that they and their families could get infected.
Amanda Klosvik is an epidemiologist at the University of Otago, Wellington. What went wrong in Taiwan, in your opinion?
It's been very hard watching Taiwan struggle to contain this very large outbreak. Taiwan has done so well so far in the pandemic. They have a very strong public health infrastructure, and their pandemic response has been excellent. In this outbreak, it's been interesting to see how different Taiwan's response has been compared to New Zealand's. In New Zealand, when we have outbreaks, we react very swiftly and very decisively to extinguish them straight away. And sometimes that means going straight into a short, sharp lockdown. Taiwan, on the other hand, has avoided using lockdown as a pandemic response so far. And that may have kept the outbreak going a little longer than it needed to.
Amanda, what I find striking when we look at the numbers is that outbreak you mentioned in Taiwan in comparison to New Zealand's numbers, the spike is really sudden, and then Taiwan manages to bring those numbers back down, but not to the levels New Zealand's been enjoying the whole way through this pandemic. They've managed to keep the numbers down so low. What's it done right?
I think the most important thing that New Zealand has got right is to have the right strategy for this pandemic, and it's New Zealand's elimination strategy. This strategy centres population health. We don't tolerate cases in the community. We react to even just one positive case in the community by moving to extinguish that outbreak as quickly as possible. That's meant that we've had very few cases, very few deaths. Our health services have continued to operate. It's protected our economy. It's protected our civic freedoms. A lot of things have come right just from that initial impulse to protect the population.
What I think is also really important to point out is that both countries are slow to immunise, which is a problem in Taiwan, but not for New Zealand.
Well, you can argue that on both sides, actually. On the one hand, yes, New Zealand doesn't need vaccines. The vaccines should be used in places where outbreaks are still occurring. They should be used in places where they can immediately save lives. On the other hand, we do feel vulnerable. We know that if we get an outbreak, most of our population is still unvaccinated.
But couldn't an even more virulent and infectious strain pop up at any time and hit New Zealand too?
That's right, and we're very worried about that. In fact, a few weeks ago, an Australian travelled to New Zealand and spent the weekend in Wellington on holiday, went back to Australia, and on the Monday, they started to be unwell and tested positive for COVID-19 Delta variant. Now, that person during the weekend had visited a large number of places around Wellington, museums, restaurants, bars, shops, all the places that tourists go. It was an absolutely nail-biting experience for us. We were waiting to hear whether we were going to have a very, very large outbreak. As it happens, we got lucky and we didn't. But it has been a warning sign for us of how badly things could go wrong.
So the warning signs are there. What is the best way, in your opinion, then, of containing not only COVID, but also all of its variants?
Well, the interesting thing about this pandemic, and this is something that we in the Asia-Pacific region have learned, is that the pandemic is controllable. It can be stopped. We have so many tools in the toolbox now. We have good vaccines. We have our public health infrastructure, that's the testing and tracing, all of those measures. And we have measures that can keep our communities safe. So optimizing ventilation would be one of those things, wearing a mask to protect others, supporting people to stay home when they're sick. We've learned so much in the last 16 months about how to stop this virus. I feel confident that it's not really a question of can we do it, but are we going to choose to do it?
Interesting stuff from Amanda Kvolswyk, epidemiologist at the University of Otago, Wellington. Thank you very much for being on the show today.
Thank you.
A brief look at some other coronavirus stories making headlines. Malaysian officials have been forced to temporarily close a COVID vaccination centre after nearly half its workers tested positive. Malaysia is struggling to deal with a surge in infections. The country recorded 11,000 new cases on Tuesday, its most in one day. And French President Emmanuel Macron says getting vaccinated against COVID will be made mandatory for all healthcare staff and other workers who come into contact with vulnerable patients. It's part of the latest measures to contain the pandemic in France, where the Delta variant is taking hold. Now it's that part of the program where we put one of your questions to our science correspondent, Derek Williams.
Will manufacturers need to modify vaccines to fight variants?
This is really just another way of asking whether SARS-CoV-2 will mutate so much that modifying vaccines makes sense. So let's approach this question from that angle. The answer is we still don't know, but a critical moment, experts say, will be if large numbers of fully vaccinated people start contracting a serious enough case of COVID-19 anyway to land in the hospital. That's not happening, at least not yet. Even if some variants are infecting more vaccinated people than earlier versions of the virus did in trials, None of them is viewed as what's called an escape variant. In other words, immunity in people who had the disease or who have been vaccinated appears by and large to be holding up pretty well. But if that suddenly changes, then manufacturers will indeed have to tweak vaccines to help manage the threat, and they're already doing so. The good news is that this isn't a new problem. It's one that we've had to come to grips with in the past. For example, with flu viruses. Flu vaccines have to be updated regularly because flu viruses evolve really pretty quickly. So the background that we already have in redesigning vaccines fast to meet that constantly evolving threat, that'll come in handy now. According to the Vaccine Alliance, Gavi, updating messenger RNA vaccines and viral vector vaccines is still uncharted territory, but it shouldn't prove too steep of a challenge. Manufacturers are also saying that they can tweak vaccines to provide protection against emerging threats within weeks rather than months, and trials with tweaked vaccines are already going on. But some experts don't think that escape variants will develop. So the question of to what extent we'll actually need modified vaccines, that's still up in the air.